Yes, I think that incorporating the patient's physician into the molecular tumor board is a key part of the molecular tumor board. And I really learned that um, from my experience when I started the molecular tumor board at University of California, San Diego, when I arrived here 8 years ago. Genomic sequencing, especially next generation sequencing of the type that Foundation Medicine applies, was really pretty new at that point. And our physicians really didn't have clinical experience with it. In spite of the fact that University of California, San Diego is a great basic science center, one of the best probably in the world, but this was very, very new. And bringing it to the patient therefore presented some difficulties. And what we found is when we brought physicians into the molecular tumor board, and they had the opportunity to ask questions about what the sequencing was telling them. And also they had the opportunity to go over the patient's history with all the privacy regulations followed, of course, but they had the opportunity to go over the patient's history and discuss, well, maybe this drug or this clinical trial won't work out because the patient has a heart condition, or the clinical trial is only available in this center and this patient cannot travel. So it's the practical matters that are so important to the patient, which the physician who is treating the patient understand, but it's also the underlying illnesses and therefore what drugs you may or may not choose if a patient has a heart condition or a kidney condition or some other condition that goes along with their cancer. And then digging deeper is really helping the physician understand why one might suggest a therapy. Because genomics is still, I mean, the progress in bringing genomics to patients has been absolutely breathtaking. I mean, tremendously rapid progress, really spearheaded by Foundation Medicine. But this rapid progress has a downside in that physicians who are experts in treating their patients are not yet experts in genomics, and having them come to the tumor board and be able to discuss their patients and understand why a certain drug or drugs are recommended or a certain clinical trial is recommended was enormously helpful. And I absolutely believe we are going to see the same thing in the community of physicians. That this discussion will help them understand and help us as the leaders of the molecular tumor board give better advice as well.